Hello, people. Let's talk about voice disorder today. What is voice disorder? Voice disorder is when you have a problem in your voice. That is the pitch of your voice, the tonation, and the volume of your voice. It means you have a voice problem. And what are some of the things that causes this voice problem? You may have growth. You might have come through an injury. You might have an illness that must have spread towards the part of your vocal cord. You must have also been having things like cysts around the vocal area and also vocal abuse. These are some of the things that could affect you so that you have experienced voice injury. And when you experience voice injury, you find that some people, they're not able to be as articulate as maybe as they used to be. There are also acquired factors that might have led to the destruction of your voice. One of those factors may be taking too much alcohol. When you take too much alcohol and they have the lethal factor, lethal in them, it kind of bruises your voice. And in your voice, it is very smooth. In your vocal cord, it is very smooth, and we have when you are speaking, there is vibration that occurs there, and so there is sliding of the vocal cord, so that when you take alcohol, too much excessive of them, it corrodes this part, and therefore speaking may become very, very difficult. Or rather, you speak, but there is a change in your voice, either intonation or your voice is just harsh. Okay, so those are some of the things that can really, really, really affect your voice. Then let's talk about the vocal abuse. Vocal abuse is mostly it affects those who their profession is involved in like talking all day. Like for instance, teachers and lecturers, they talk the whole day. Okay, and now other factors is screaming, shouting, and constantly clearing your voice. These are some of the things that could also affect your vocal cord so that you're not able to be as articulate as you're supposed to be. Some of them are illnesses, as I said earlier, but there are also prevention factors that we can put in place so that we don't interfere with the normal vocal strength or the normal vocal capacity or volumes, okay? So some of these things that you should put across and learn is learn to raise your voice, especially if you're a teacher, you're a lecturer, or rather you involve job that constantly wants you to speak with people probably for 24 hours. You need to set time every day to rest your voice. You also need to take a lot of liquid to help you with your voice. And if you realize that you stress too much or you strain when you want to speak and the vocal cord is kind of painful, you really need to find ways of not speaking when you feel that the vocal part is actually irritating or it's painful. You can also take fruits. Fruits also neutralizes the vocal cord and helps it a lot to be healthy and to be strengthened. Okay, ensure you also wash your hands appropriately before you take anything into your mouth. Okay, so and also learn the other ways of healthy vocal use and healthy vocal rest. This could actually assist you. There is one factor that I want to take you through, and it takes someone who is mature to understand whatever I'm trying to say. So this is a lollipop, and when you're taking your lollipop, you must be sure of how you want to take your lollipop. And I'm going to show you how you're supposed to take your lollipop. This is how you're supposed to take your lollipop. That is how you're supposed to take your lollipop. But if you take your lollipop in the wrong way, I hope you saw the two different ways of taking your lollipop. If you take your lollipop the right way, you will be okay. The first one is the right way of taking the lollipop. Second one is the wrong way of taking your lollipop. The third one, look at my lollipop. If you can see, this part is opened. This part is opened. So be sure that your lollipop does not contract infection around this place. Before you take your lollipop, ensure that it's all wrapped out. It's all wrapped out before you take it. Ensure it's all wrapped out. If it is not all wrapped out, it is going to have dust around this place, which is not healthy for you. So if you take unwrapped lollipop and you put it, it's going to give you a problem. And let me explain why. Taking your lollipop in the bad direction is going to affect you. So in the vocal cord, we have very soft linings, and the soft linings are very healthy, and they are also soft so that nothing can bruise them, and they're naked. So when you take anything that is not supposed to be taken through it, it is so easy, especially when you take it like this. It goes through your vocal cord, and this is going to bring a lot of infection in that area. So you're going to incur cyst, or this area is going to swell. They're going to be very, very little, how do we call them? I've forgotten, but it's going to swell up. And when it swells up, it's going to interfere with your vocal cord. So before you take your lollipop, consider the factors of taking your lollipop right. If at all you have to eat lollipop, consider the right factors to take your lollipop so that you don't interfere with the normal vocal cord. Okay? And when you eat your lollipop should be eaten like this. But when you want to eat it like this, be very careful so that you don't get infections that would interfere with your vocal cords. Remember, I told you there is a smooth lining here, and it is fine and very smooth, and it is prone to infection because of its smoothness. So you need to take the right precautions of taking your lollipop, if at all you have to take your lollipop. Otherwise, I hope you learned something. Bye.